My name is Dr. Rick Seguil.
And action. Hey, Jay had a... This is Kirk again.
Stress and investment.
And action. Hey everyone, it's Dr. Rick. And Linda had a question about eating for high blood pressure. So, there's people who get diagnosed as hypertensive. There's also people who have white coat hypertension. And regardless, both of them say that we're going in the wrong direction. So the wrong direction would be to allow high blood pressure to take take some damage from your high blood pressure. So just think of it as your house. And if in your house, all the piping, it was built for a certain amount of pressure coming from the street pipe, the water company, then if the water company were to turn on the pressure, the pipes that are in your house or the dishwasher or the refrigerator or the water heater, all of them that depend on water, if you suddenly increase the pressure, those things will break because they're not built for higher pressure than what the pipes are measured at. Does that make sense? Or if it does make sense, good. And if that happens to your body over the course of months, years, decades, it will cause damage. Usually it's problems with the eyes, problems with the heart, stroke, or kidney, end-stage renal disease. So there's other things that happen too, but that's why it's so important to address high blood pressure when it's in its early stages. The problem is, in its early stages, people don't feel anything, so it's kind of disempowering to say, I'm going to invest in exercise. I just came from the gym. I was there this is a weekend, so I'm there for about half an hour versus 15 minutes. And it was very filling. It was kind of cool. But I know that right now my blood pressure is probably low because usually within about an hour to 3 hours of exercise, blood pressure drops. Normal response. Same thing with happiness. By the way, if this is the first time you're finding me, don't forget to hit the subscribe button down below and the alert button to find out when I do new videos. So let us talk about, so if you watch my other video on bypass and diabetes, I use the same board, but I erased everything else. These are blood vessels. That's a regular blood vessel with the blood in the middle. That's a blood vessel with the beginnings of coronary artery disease. And this is a blood vessel in its fullest form of atherosclerosis and coronary artery disease. Now, obviously, the lumen, or the inside, is big here. And it's kind of halved to even 100% stenosed or blocked here. So you can figure just with what happens to somebody's blood vessels when cholesterol accumulates, there's no more room. If there's no more room, and this pipe is supposed to deliver life-giving water from the public works of water to the house and to our fridge and to our dishwasher and to our water heater, if the pipes are tiny, I said before, if the pressure coming in was too high, that's bad. If the pipes are too tiny, then that's also going to squeeze all the water that's currently in the house and make it a higher pressure with the end organ, or the end, the utility thing that you have at home. I can't think, those machines that I mentioned, dishwasher, refrigerator, water heater, you're going to damage them because the piping is narrowed. Or you're going to damage them like before because the pressure coming into the pipe from the street is too high. So those are all really important. So just think of the pressure coming in from the street as your overall pressure, your heart pressure. There's a formula for figuring out blood pressure, but we don't have to go into the details. I just want you to understand the concepts. So that would bring me to my first reason for having high blood pressure. Narrowed arteries are what some people refer to as hard arteries. When you have hardening of the arteries, you have narrowing of the entire lumen, and if you have narrowing of the lumen, it'll increase the pressure to the whole system. So it's not good to have what causes hardening of the arteries. The old school thinking was that cholesterol would cause, this is supposed to be a cholesterol plaque or an LDL, cholesterol would cause hardening of the arteries. As you can see here, I believe this is a nice book, but it's funded by a drug company, and I don't know where the drug company's name is. So, old school information, pretty decent. I still believe in it if you're at your worst presentation. Completely blocked off arteries of the heart, about to have or having a heart attack, I would follow the data because unfortunately you've allowed yourself to progress on. No matter if you're 70 or 40, if you're having or confronted with a stent or a bypass, you've allowed this to go on too long. Should have done lifestyle change early, but that's okay. Even if you get controlled with your surgical procedure, which the United States is really good to have surgical procedures, I would want nowhere else to be in the world except for the United States. If I have major motor vehicle damage or trauma or life-ending disease of an organ, it's great a tumor of some sort. Knock on wood, I never have that, but the United States is great because we can fix things when they're falling apart. The idea, though, is to forget, hopefully you don't need this, but get to the point where you can fix things ahead of time before they even take hold or take effect. So healthy fats would be important. So understanding that the eating too much bad food is a bad thing, and everybody understands that. Eating too much good food is a bad thing. So obesity is when essentially, and there's more to the formula than this, but obesity happens in some cases when you just have too much fuel, not enough fuel burning. So if you have too much fuel going in to your body and you don't burn it up, as you get older, we're busy, and as you become parents, you're busy, and you can't find the time to exercise. Well, you should decrease the fuel source, the food going in, and usually that will lead to a lower pressure. There was an interesting experiment a long time ago. Ansel Keys was involved with this, but starvation diet, where they put a bunch of people, I think it was in the 40s or 50s, essentially on no food. And they watched the mechanics of what happened to the individuals, and blood pressure lowering was one, but that usually is because the body was going into starvation, shock. And that's one way to do it. I'm just using that as an example of if you eat too much, pull it back a little bit. Bottom line of the formula of eating, if you decrease your weight, you should do okay. So it's not that everybody that's got high blood pressure is overweight, but a lot of people going into obesity, which is 2/3 of the United States, will have hypertension at one point in time. So holding back the line of getting more and more heavier would be important. So obesity is a very important thing to understand. If you go by the old school techniques, cholesterol is also important to have good saturated fats. American Heart Association suggests low saturated fat, and it's probably a good idea. I think fat, so now comes the argument of keto, whether keto does well or not. And Mercola's pretty good with his info. I think it's just expounding upon the old guys. Volek and Finney, great information on ketosis. Mostly started with athletics, cyclists, and then they fine-tuned it, and a lot of people are doing the keto thing. I found it very arduous to calculate all the stuff I was supposed to eat, or at least get used to that type of eating. But there's no question, if you ever see anybody that has become keto adapted, one of the biggest side effects was their blood pressure drops. I've had one patient go to the emergency room because he got up in the middle of the night, fully ketoed, but he got up in the middle of the night and he fell down, hit his head. So one theory, according to Volek and Finney I think came up with it, was that when you do a ketosis, meaning all fat, and hopefully healthy fats, but all fat, very, very, very little carbohydrates, and only a moderate amount of protein, but mostly fat. And when you get keto adapted, or what they refer to as a well-formulated keto diet, and ketogenic diet, you can get more pliable with the blood vessels. In its infancy, the blood vessel will be really elastic. When it's elastic, it can take the pressure. If it's the heart that's pumping too hard, it can take the pressure. It'll blow off. It'll become distensible, and it'll actually show you as having a normal blood pressure, which is good. That's why in people who are really well keto adapted, you actually have to push salt in, which we'll come to later on down the line here. So the people that have adapted to their ketotic or ketogenic nutrition, they allow a lot of salt to compensate for those episodes when they get a little bit too dizzy. So if you can do it, then sometimes it takes up to 6 weeks before you do that. Some of that my patients will say is a deal breaker. A lot of people want to see things fast, and ketosis, well-formulated ketogenic diet is important if you can find somebody to help you. I wouldn't just take something off the internet. And also checking your blood would be important if you're going to go down that route. I think it's worth it. I have no problems with it. but it is tough. Like any nutrition change, it's tough. So obesity, we've already talked about that. Lose the weight. If you lose the weight, then all those little markers will change. Hopefully, cholesterol, inflammatory markers, diabetes markers, and your blood pressure. Doing healthy fat or no fat, it's totally up to you. If you just decrease the volume, you should get to the point where the blood vessels become more distensible. If you want to do keto, great. If you want to do paleo, that's fine too, because in the end, all the diet choices you will make will all be initiated for the goal of losing weight. If you lose weight, then usually the blood pressure drops. So that's the other thing. These blood vessels have a coating of fat around them. And think of if you have a very delicate bunch of potato chips that are on the counter. You just lay out your potato chips and you put a paper towel on top of the potato chips. The potato chips are fine. If you then put something else on top of the paper towel on top of the potato chips and start weighing it down, the potato chips will crack. So the same thing happens with these tiny blood vessels. There's a whole bunch of tiny ones. In fact, the largest amount of space, intravascular space, is in the capillaries, the farthest ends. And if you look at the capillaries, and you press down on those beds of capillaries with extra fat, maybe too much muscle, then you'll manifest along that closed system, somewhere along the line, you're going to manifest higher pressure somewhere else. So like a balloon, if you have a long balloon, you tie it off and you squeeze one end, it gets big, squeeze the other end gets big, you see that? Well, if you push on the capillaries, the other end is going to manifest as hypertension, and that is what happens with obesity. So losing weight will help. Moving will help. So losing visceral body fat will definitely help. So again, I think we've beat that down, but losing the weight, maybe shifting the cholesterol if you believe in the cholesterol hypothesis, and finding a healthy nutrition practice would be important. Second thing is higher heart output. So if the heart is the pump and the pump is pumping hard, then it's going to manifest regardless of how these blood vessels are, elastic or constricted and stiff. If the heart is pumping that hard, it's going to manifest as hypertension. So think of it as taking too many stimulants. And I just had coffee this morning and I was still tired because I was tired. Probably poor night's sleep. It's also the weekend. But because of that, I had to get more coffee. The coffee that I had certainly stimulated up here immediately. And it's kind of nice about coffee. But the problem is later on down the line, it also stimulates here and all these blood vessels. So if you have coffee in the daytime to perk you up and give you a sense of well-being, that's fine. But that same coffee cup or pot will later on still be affecting this and the tiny capillaries. So even though you can say the coffee is just a couple cups in the morning, it will still affect later on as far as compressing these blood vessels to give an overall hypertensive response. So be careful with your coffee intake. If you need caffeine, that's fine. If the caffeine is causing a side effect, that's not fine. It's just like a medicine. If you need a medicine to save you, great. But if the medicine is causing too many side effects, the risk to benefit ratio isn't there. So if the caffeine is not helping you overall and it's harming you, I would suggest getting better sleep. So the sleep thing, if you had really rested properly and the brain got rest, not just closing your eyes and waking up at the other end of the day, at the other end of your sleep time, but also having something refreshed with your sleep. So I often ask people, how many hours do you sleep? 7. Great. You wake up refreshed? No, and that's not great. That means you're either you're having sleep apnea, or you're too sensitive to sounds and stimulants, too anxious, or there's something else going on, menopause, andropause, maybe there's a sleep apnea issue. So bottom line is you might need a sleep study. However, sometimes too many stimulants are not a good thing, so watch yourself. Alcohol is also a stimulant. So a lot of people that have problems with sleep will have a shot before they go to sleep, and probably okay, it'll make you sleepy because that's one of alcohol's effects. It can stimulate you, it can also make you sleepy. But if you dial it in, you might be able to get it to make you sleepy. The problem is alcohol has a half-life, or zero order half-life in the liver. That means that by the time it's digested, it's going to wake you up. So think about 4 to 5 hours later. So most people that have a shot or a drink at night, a glass of wine at like 9, by about 2 or 3 in the morning, you'll probably wake up because you have to pee or its effects are gone, and then you're back to where you were before you had that wine or alcohol or shot. And if that was anxiousness, then you've got to deal with the anxiousness or have another shot at 3 in the morning, which is not good. So I'd rather have my patients do medical cannabis than alcohol. There's too many calories in alcohol. I think it's a good thing for the social situation, especially because we're brought up with that, especially in France, Italy, but this is the United States. We have a whole bunch of crap. We don't have the same lifestyles as over there, and in fact, it's called the French paradox. They drink a lot of wine, they eat a lot of meat. You wonder why they have less heart disease than we do. That's what was referred to as the French paradox. Same thing in Spain, Spanish paradox, with regards to their frying. They do fine, we don't do fine with it. Why? It's because our lifestyle in the United States is totally more complex than theirs. It's not more complex, it's very complex. Any lifestyle, and we just have too many layers that are really built on bad health. So watch the coffee, watch the alcohol, and if you have secondary smoke exposure, you got to get that person out of your life. That tobacco is an irritant. The irritant will drive blood pressure high, so stay away. So coffee, alcohol, stimulants, and that would be also in the case of allergy medicine. If you have a lot of allergy medicine that helps to clear up the nose, pill-wise, decongestant, it's going to make your blood pressure high, so be careful. I think quercetin is a nice allergy medicine that doesn't really cause too much blood pressure hit, but it does make you sleepy. If it makes you sleepy, in the long run, you're going to be sleepy at night, not getting good sleep, and then you're going to be tired in the morning, and you're going to need more stuff. So you see the bad feedback. So I would rather, if you have allergies, especially this area, Chicago, I'd rather have you take honey, local honey grown in an area. A friend of mine just told me that she had very good success, and the theory was always there, but sometimes using honey will desensitize you to those plants that are in the area, especially if you can find a local beekeeper. If not, then you try to get your allergy specialist to give you sublinguals, injectables also, to desensitize you. It's like one sublingual or one injectable every week, I believe, for up to a year to desensitize the body, so it's okay. And clean, wet dust your house, vacuum the house, wipe down the doggy when the doggy comes in, and rinse out your nose. So those will all be helpful. Next on the hit parade, and the other thing is sedentary life. It was a paradox, but sedentary life, you would think, well, the heart's not moving, right? And you would think the blood pressure should be okay if the heart's not moving, but if that person has to get up, which usually they'll have to get up sooner or later, when they get up, that sedentary person, then they're expending just to go pee or to go eat, to go downstairs, and the heart, against all that fat, if they are overweight, body fat, both visceral in the stomach and peripheral, that will cause that heart that has to get moving suddenly to exert a high pressure. And that too will be episodic, but if you have an old person that they just go to the doctor's office, by the time they get in the doctor's office, from the parking lot in through and using the walker into the chair, into the examining room and get the blood pressure, it'll be super high. So that's why sometimes we let them rest a little bit. And if you get your blood pressures at Mariano's, Jewel Osco, or Home Cuff, I'd vary the times that you get it. If you are on a medicine, fine, but you want that medicine to work at the worst times. The worst times that I can think about are Monday morning, when high stress in the world increases heart attacks all over the world. Statistic is that the highest amount of heart attacks occur Monday morning about 8 to 9 a.m. That's because of the stress. I would also want that blood pressure controlled when you're in an argument, when you're stressed out. If the blood pressure is locked down with your medicine during those times, then that's cool. It's good medicine, as long as it's not causing side effects. If your blood pressure, you're just taking it, but you're having spikes like white coat hypertension, going to the doc's office, it spikes. It's not good that it spikes. Even if you sit there for about 5 to 10 minutes, turn off the lights, do some deep breathing, and then you take the blood pressure again, that means you still got spiked. And if you get spiked, that will be eventually a stroke or a heart attack. So that technically means, even if it's white coat hypertension, or you just got into an argument, or anything like that, that means that medicine's not protecting you, so you might have to dial it up. That's how we figure out how aggressive to get with medicines. So there are some safe medicines. Before I get on to number 3, there are some safe medicines, but some of them will have side effects. Most of them will have side effects. But the risk versus the benefit is there, because if you're totally uncontrolled, you do the lifestyle changes, you're still having high blood pressure that technically is greater than 140 over 90, you're at risk, no matter what age. There are old studies that were put out. More of the recent stuff, there's a SHEP trial, there's the Accord, there was one for African Americans, AASK, and then there was a Sprint trial that was more recent. Most of them, and then there's the JNC8, and then the American Heart Association's 2017 suggestions, which are a bit confusing because they keep on going back and forth. But bottom line is, I think we can all understand that if you have a higher pressure than 140/90, you're in imminent danger. So it depends on what other medical problems you have. If you have metabolic syndrome and that, asking for trouble. Even if you don't feel anything, you're asking for trouble if we don't address it. And if the annual visit with your doctor says, try to lose weight, and you're not losing weight, that's okay, keep on trying, but you got to put some layers of protection on. So if you're going to go swimming and you haven't passed your swim test and it's going to be deep, you really should be doing something protective, and that might mean herbs. I think for blood pressure, not the swimming thing, but blood pressure, I like dandelion root, I like beetroot. Beetroot's a little more expensive, dandelion root's easy. Hawthorn berry is nice. Or just plain old magnesium and potassium. So I think all those things would be helpful. But as far as everybody's got to be tailor-made, because if you have spikes into the 200s, all these little steps are not going to take care of that. You got to come up with a reason why, and that's up to the diligence of the workup of the doctor. So you can always think old school is good, and just losing weight, but I think it's more to it than that. Because a good book brings up a lot of nice things about carbohydrates and data. Taubes does, but I don't know. And he does some research, so as a writer he's good. But I don't see him giving other suggestions that are helpful for our population today. So move. Don't be sedentary. Consider cutting back on alcohol and tobacco and coffee. Consider a better sleep hygiene program. Consider losing the weight. Consider maybe finding a new nutrition practice. If you have somebody in your area that does keto, do it because they're in your area. If most of the people in your area are paleo, do it because you have a large community. I'm vegan at this point in time and intermittent faster. If you have the fasting people, somebody that's really well versed with it, do it. There's not one that's better than another. But bottom line is you have to make a change. And if you are a little bit overweight, BMI over 25, that means you're overweight. I had a guy ask me, I said, you're a little bit overweight. His BMI was 28. And he was very surprised. And he probably has friends that are huge, but he was overweight. You can see his tummy stiffening. And that's the beginning. A waist to hip ratio like that and a BMI greater than 25, that's the beginning of metabolic syndrome. I mean, you can wait until the other markers become positive, but and then you can wait after that till you become effectively short of breath and chest painy. But I wouldn't wait. I would take it back a notch, a couple notches. That's why I invest in exercise so much. I just came from the gym, again, half an hour. I think it's worth it. I can't do more than that. 15 minutes on the weekdays, that's all I can afford. But it's better than doing nothing because there is a upside to that. So the water retention thing, there is the possibility of having too much water. Usually that's with too much sodium. So the old DASH diet makes sense. That's where Willett came in, and with the guys at Harvard came up with a food pyramid. I think it makes sense because a lot of the bad foods in the United States are kind of based on preservatives, and that's where the salt comes in. Or lousy foods that are not old school, traditionally cooked, they're bland, and that's why you have to put a lot of salt in to douse it. Or sugar, because salt and sugar are the most powerful, two of the most powerful senses in the mouth. And if you don't know how to cook and you just cook something like boiled beef or boiled chicken, how many people think that's appetizing? No, but until you start putting spices in. But if you don't know how to do that, yeah, salt and sugar. So that's why fried stuff in the South, there's nothing against the South, it's good home cooking, but if you look at the highest blood pressures in the U.S., they're all in the South. So it could be African American, it could be there's a salt issue, it could be that we have a high obesity rate, but there happens to be correlation. We can't say it's causative, you can only say it's correlating with it, but until somebody says it's causative, you can't hold too much weight into that. But I think that if you just, again, work on the weight, work on changing nutrition, that'll work. So it might work in a long amount of time. But so we're still talking about sodium. If you can cut back on sodium, if you agree with the DASH diet, cool. If you don't agree with the DASH diet, and there's some things, and when I tried to get my patients to do DASH, it wasn't spectacular. It wasn't novel. It wasn't exciting. There are newer ones that are exciting now, like Stephen Phinney's or Paleo. Cordain was on a roll for a while. Atkins was on a roll. Now Walter Longo is on a roll. So I think there's things that you can take advantage of. But if you have deficiency in potassium and magnesium, I'd fix that for sure. Most of my patients do. I think increasing your potassium would be important. Getting it from food, you could. Magnesium from food, you could. A lot of dark leafy greens have potassium. A lot of beans, legumes, and seeds have magnesium. And you could do it that way, but if my average patient is overweight, and I'm going to tell them to take care of their supplementation deficiencies with food, you're going to increase your volume, and we're trying to cut back on volume. So I shortcut it. I just say take the capsule for sure. And they're mine I get for $11, and that holds me for about 2 months. That's not bad. Pretty good quality. That has to be dialed in, has to be checked first by your doctor. So I'd always say take care of your issues first. If you're having water retention because your kidneys aren't working, fix that. If you're having water retention because you're not active and your legs act as a sieve, then maybe compression, or get the surgeon to take care of the blood vessels on the outside. That would help. Always does. I have a great blood vessel doctor for varicose veins in Elgin at Sherman. So, but that needs workup. So, so next would be, and most important to me, would be fight or flight. And if fight or flight is the reason that you're getting really hypertensive, that's part of the white coat hypertension thing. Anxiety, but more always on demand and stressed, then calming would be important. A friend of mine from Harvard came up with this book, and I really love going into nature. I hated nature when I was a kid, but I love it now. Mostly because you're in isolation, you don't have internet access in some places, and you just have to be at the speed of nature, which is usually slow and calm. If you have a calming practice, great. If you don't, then you can get into nature, but you got to be in nature like twice a day for about 5 to 10 minutes. If you can't, and you don't have a great view from where you are, whoops, make your own nature, make your own view. Or have a calming practice. I'll put my 4-7-8 breath exercise that Andy Weil taught me, and I use that when I can't be in nature, but I'm always in nature. So I take people out. Check out my Facebook page, Dr. Rick Hiking Excursions. So it'd be important to have, or get counseling. Counseling would help. Some people, just to beat the anxiety or PTSD, like to do medical cannabis, and that's fine. But if you do medical cannabis but you don't do the constructive work to calm and desensitize and turn off the amygdala, then you're just going to be taking more and more cannabis. And again, the benefit to risk ratio, you're going to be high all day. That's not productive. Get the calming in with the cannabis, but do the therapy. CBT, cognitive behavioral therapy, EMDR, all these are great, but you have to find somebody to help you to teach that. And finally, inflammation at the end. Inflammation usually comes from cancerous foods. That's why Walter Longo came up with this. It's a fast 5-day fasting diet called the FMD, fasting mimicking diet. It's based on, anybody could do it. You don't have to buy the box, but it's better with the box, it's easier. But it's based on cancer fighting. And I think inflammation is based around carcinogens. All the food that we have, especially like lunch meat, heavy carcinogen. So if you have carcinogens in you, your body's going to react to that. It's going to usually be a fight or flight response on the inside. So he has done great work with using food as a powerful tool, almost equal to chemotherapy. I'd say read into Walter Longo's. And I have a couple of patients that are following me on Facebook that we're doing this together. But get the crap out of you. So if you can stop the fast food, usually high preservatives, better off. If you can stay away from carcinogens, plastics, things that are full of pesticide. The Dirty Dozen's important to get organic. All those things, again, sometimes if you get microwave foods, but they're heavily, if you can't read the ingredients or don't understand the ingredients, if they're all chemical at the end of the ingredient label, it's probably not a good thing. But that will cause the body's fight or flight response. Also, believe it or not, too many medicines. If you're on a lot of medicines, they'll interact. The mood medicines, the pain medicines, the sleep medicines, the blood pressure medicines, and the heart medicines, they'll all interact. And it'll back up the liver, and it'll cause hypertension. So you probably should whittle those away, not on your own, but by going back and taking care of the basic building blocks. So the basic building blocks, if you think about it, and I put down inflammation also gets reversed by taking care of all these things. Basic building blocks are like Ayurvedic eating, traditional Chinese eating, or Chinese medicine, the way they eat and use food to heal. Ayurveda is Indians' way of healing, but there's, depending on the medical condition, you have certain foods that they suggest. Food prescription is very important. If you just don't know anybody that does that, just follow the blue zones. People that live to 102, they do so because they usually don't have any of this stuff. So it's based on a lot of movement, walking, family belonging, happiness, a whole food, mostly plant-based diet, and it seems that people can follow this lifestyle, but it takes a lot of adapting to do it, especially if you're into the typical American lifestyle, which is fast, underslept, and furious. So hopefully this gives you a couple of ideas on how to address high blood pressure. So Linda, even though you had a question about what to eat for hypertension, it's more than just the eating part. Because if you just do the eating part and you don't do the exercise part, don't do the calming part, you might be missing a couple things. If that's all you need, then cool. But I would always say there's other things coming down the line, whether menopause is coming or not, and doing all three: nutrition, exercise and movement, mindful practice and calming, looking ahead and teaching other people, all those things, being involved with making the choices for food, they're all important. So if you just want to cherry pick, that's fine, but in the end, hopefully it gets you to the point where you can go every decade and get less medicines, maybe use herbs to do it. If you're really very complicated now, you got to get your regular doctor to help you, and then you get your integrated medicine doctor to help you, and you get your team of nutritionists, exercise physiologists, psychologists to fine-tune even further until you drop down in category from severe to maybe moderate, or from obese to just overweight. So it always takes a step in the right direction, but sometimes if you just do this on your own, you'll be very frustrated because you don't see the results. So know that there's a long plan, know that there's a short plan, and it takes understanding to do that. That's what I love this about integrative medicine. We try to take as much time in the beginning to learn the nuances of the patient and then target specific weaknesses and bolster the specific strengths and usually get to goal. If you don't, then we reformulate that, but that's what's different compared to the average 7 to 14 minute visit. So hopefully this helps, Linda. For all of those of you who do have other patients that are family members who are suffering from white coat hypertension or high blood pressure or have had a stroke, send this to them and share it. Otherwise, I'll see you at the next Minute Clinic.